June designated as Pride Month.
Yeah, Channel 5's Tanvi Verma takes a closer look at the challenges some in the LGBT community are facing here in the Valley when it comes to securing medical care.
Madeline Kroll was just over 30 years old when she decided it was time to become a woman, something she thought would help her mental health, bringing in challenges of its own.
I want to say it was around 3 months before I was able to find a specialist who was willing to do that.
Shuffling from one doctor's office to another, she couldn't find anyone who would treat her. And then after finding someone, she couldn't find an insurance plan.
I have worked for employers who have provided health insurance that specifically excluded care for me, specifically as a trans person.
Kroll's story resonates with Gabriel Sanchez, who's looking forward to having a child. Sanchez says it's been hard to find care as a member of a gay couple.
Face whether it's accessing prenatal care or accessing, at the time of birth, or finding medical care providers that are going to affirm us exactly how we are.
Sanchez works on LGBTQ advocacy in the Valley and connects people with medical professionals who will care for them. But Sanchez says here in the Valley, the issue of finding a provider is tough.
We're in a geographically rural area, and we're also in an area with a lot of poverty. And so there tends to be a struggle with accessing resources just in general. And I think it's hard to explain to people who have not had to go through that, the anxiety that it can cause, that fear of being rejected.
Dr. Lisa Campbell Engelstein with the University of Texas at Galveston says doctors are completely protected in being able to refuse care.
So if someone says, ooh, that goes against my religious or philosophical beliefs, we want to allow that flexibility for them to do that. However, the concern here is that this may then disproportionately affect certain groups.
She says her goal isn't to make doctors treat people they don't want to, but to spread awareness on the effects this may have on the LGBT community. Sanchez says reaching out to STEP, the South Texas Equality Project on Facebook, is the best way to get connected with a list of providers who will treat you. Tanvi Verma, Channel 5 News.